an inflatable bowel at the front of Parliament buildings. And Barry McAree, a coracular surgeon, takes us on a tour to show us the benefits of early diagnosis of bowel cancer.
We'll give an example of what a normal bowel wall should look like. And here we have some examples of precancerous polyps. And these are things that basically can be removed with colonoscopy at effectively what's a minimal cost, be it a pre-cancer or even an early cancer, with no further treatment essential, and much better than getting what is this, which is a colorectal cancer, large, centrally pitted, rolled edges, and this means that this cancer has been found at a time when hopefully staging scans will show that the patient can have an operation and still potentially get cure, but you're more likely going to need chemotherapy in some cases, say for example if the lymph nodes were affected, but also if it's got to this stage, unfortunately there are those who will not get cure.
Chris Robinson only showed one symptom, and at 52 he waited 6 weeks on the National Health before deciding to use his health insurance.
I felt, well, I need to do something, so I kicked that into place and was able to get an appointment with a doctor at the Ulster Independent Clinic about 4 days later. 2 weeks within of that appointment, I had a full bowel cancer diagnosis with a tumour in the rectum around the size of a Coke can they were talking about. So quite a hefty one. That was in August 2017. In September 2017, I had my bowel cancer operation in the Dundonald Hospital here. They removed 18 inches of bowel along with the associate lymph nodes and the tumour itself.
Genevieve Edwards believes it's not just early testing that will result in diagnosis, but how the results are examined should be on a universal basis.
At the moment, the recommendation is that they're looking for 20 micrograms of blood in a gram of poo. The sensitivity of the tests in the other nations is at 120, apart from Scotland that's currently testing at 80.
With bowel cancer, it's not, maybe the right term here, but it's not a sexy cancer. It's about bodily fluids, it's about feces, it's about poo. It's about the stuff we generally don't talk about in our normal lives. You know, you wouldn't sit around the table in the pub talking to your mates about how you go in the toilet or not. So it's something that, especially for men, I think is kept inside. But if you're having any symptoms, anything doesn't feel right, you know your body best more than anybody else. If anything feels wrong, get that test. And the tests are so easy now with these new fit tests. It's just a little scraping of poo, send that in, get the results back in a couple of weeks. So easily done.
Dougie Beattie, GB News, Stormont.